fundamental reasons that having a quality primary care provider can be super powerful. Having a primary care provider can literally save your life. And here's how. Hey folks, first, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and I need to encourage you. You or someone you know needs to hear what I'm about to tell you. And if that's true, I want you to make sure that they have this information so that we can help them. Now, I cannot begin to count the times I've had a new patient here in the clinic who, when I ask if they have a primary care provider, they tell me that they don't. And when I ask a few more questions about this, I dive a little deeper. Some common reasons given for not having a PCP, a primary care provider, some common reasons for not having a PCP are, I just don't go to doctors, or I don't trust medical people, or I don't want pills, I don't want surgery. I'm healthy as a horse. Why would I need a PCP? I just never need to go or have a reason to go. And while all of these are very good and potentially valid reasons to the person themselves, they're good excuses to not have a PCP. In the grand scheme of things, they just don't outweigh the potential harms that can arise from not having a PCP on your healthcare team. Now, what is a primary care provider or a PCP? Well, a PCP is essentially a healthcare system treater and conductor or navigator of sorts. And when it is not an emergency, a PCP is usually the first point of contact for patients in the healthcare system. And what that means is that they can treat various common issues that might be wrong. They can prescribe medication when appropriate and manage the patient's case all right there in their clinic, but no provider can ever know all there is to know about everything. No provider can be an expert in everything that they encounter. It's just not possible. And for that reason, they're also known as healthcare conductors or navigators. And when a patient comes to them and has a condition that they can't really treat themselves, so they typically have a good idea of where to send them. They help conduct the trajectory of the patient's care and navigate them to the right specialist for their right specific condition. Harvard Health says, primary care physicians are generalists who see adult patients for common ailments including respiratory infections, headaches, back pain, and urinary infections. They also manage chronic conditions like high blood pressure, diabetes, heart disease, obesity, anxiety, and depression. In addition, PCPs have expertise in managing multiple treatments, medications, and the interactions between them. They can address the entire person, taking into account their values, beliefs, and preferences. Now, ideally, a PCP has a long-term relationship with their patients. They usually know the patient and are somewhat familiar with their health journey and familiar with what's going on with them physically and sometimes mentally. A PCP is a patient's partner in health. And don't we all need just a little bit of accountability from time to time? I know I do, and I doubt I'm any different than you are. A recent research project said, quote, receipt of primary care was associated with significantly more high-value care and a better healthcare experience. And here's the thing. When you have a PCP that you like and that you trust and that you keep regular yearly visits with, well, your PCP will know you better than any other doctor. There's a familiarity there, and there's some comfort in that. If you just go to an urgent care clinic here and there randomly, your care is typically non-congruent, and you typically will see different providers when you go. And that incongruency can be the root of some potential issues and harms. Now, the biggest reason you need to have a PCP, well, they help you prevent disease. They keep you out of the hospital. They keep you on track, and they keep you from missing very important milestones. That's right. You don't always go to the doctor when you have an issue. You can go to the PCP most of the time to prevent issues. It's always preferable to find things that might be on the horizon in your future rather than trying to treat a problem after it's already here, currently, right now upon you. That's not good. Take osteoporosis, for example. Females are particularly susceptible to it, right? We all know this. If they never have a yearly medical visit, if they likely never have a bone scan, which can let them know that it's lurking, if it looks like their bone density is trending toward osteoporosis on the horizon in the future, well, there are things that you can do to slow it or even prevent it altogether. And now, isn't that alone worth a visit to your PCP? Of course it is. PCPs keep you on track for things like when it's time for a colonoscopy, a mammogram, prostate blood work for men, or a bone scan, as I mentioned. PCPs are experts at handling a lot of conditions, certainly long-term diseases like cancer, diabetes, heart disease, high blood pressure, high cholesterol, right? Those things are important. And a PCP is who controls that. PCPs aren't used for just getting healthy. They are also there for staying healthy. And it's a lot cheaper and a lot less painful and takes a lot less time and effort to stay healthy rather than try to get healthy. It's been proven that staying in front of issues rather than behind them is much more expensive in the long run. Routine screenings by your PCP will help you catch issues early so you can get them handled and maybe even prevented altogether. Now, wouldn't you rather know that you're pre-diabetic rather than diabetic? Wouldn't it be better knowing you're pre-cancerous rather than cancerous? Pre-osteoporotic rather than already there? Well, these are mostly rhetorical questions, okay? Because of course, You'd rather know before than after. And having a good PCP that knows you, knows your goals, your medication, your history, and your current state of health, well, that's exactly how you do it. If you don't have a primary care provider in Amarillo, Texas, and you need to get set up with a PCP, we have a medical provider right here with a schedule that allows you to come in probably on the same day you call. So call us right now during business hours at 806-355-3000. Let's get you set up with our medical provider today. If you're not interested in doing it for yourself, I'd like to urge you, get set up with a PCP for your family, if not for yourself. Children, brothers, sisters, moms, and dads, all of them. Your family wants to keep you around. So, if not for you, set up with a PCP today for them. If you're watching us on Facebook or YouTube, I want to encourage you again to like, share, and subscribe. Get this information to those of you that you know who need it. All of it makes a difference. And who knows, maybe you sharing this video with them encourages someone to finally go to the PCP and maybe maybe that visit ends up saving their lives. It happens every day. And wouldn't that just be amazing if it was because of you? Now, until next time, stay smart. Call us here at Creekstone if we can help you, and we'll see you again next week.